from the College by the Lake, Coeur d'Alene, Idaho. Local, regional, national, and international guests discussing the issues and topics affecting the way you live are on Forum, the North Idaho College Public Forum, with your host and moderator, political scientist Tony Stewart.
Today our subject is holistic medicine, and I know many of our viewers will find this most intriguing and helpful because we are all very concerned and interested about good health in life. Our two guests today will talk about holistic medicine in the perspective that we want to discuss integration of conventional Western medicine with a wide variety of complementary healing practices. We're very fortunate to have two people who are most qualified to deal with this important topic. I first of all welcome to the program Dr. William Corral, who holds a BS degree with honors from Yale College. He also received his medical degree from Stanford University School of Medicine. He interned at Mount Zion Hospital and Medical Center in San Francisco, and he also did residence at the Stanford University Medical Center as well as the University of California at Davis. Our guest also is in solo practice in family medicine in Spokane, Washington. He's also a staff physician at the Sacred Heart Medical Center Health Management Clinic in Spokane. Dr. Corral, thank you for taking time away from your practice to be with us and to discuss this important subject.
My pleasure. It's great to be here, Tony.
I'm equally pleased to have with us Susan Filley, who is in partnership in more than one way with our other guest. She is a counselor, a conference facilitator, an educator, and a public relations director in the holistic health field. She has worked both as a sales representative and a director in many areas of health service, and she holds a BA degree from the California State University at Chico, and she's also stayed, I've noticed by her resume, in Sweden, among other places. Susan, it's a pleasure to have you on the program.
Thank you very much, Tony.
And as always, I'm very pleased to have our two regular panel members to question our guest today. First of all, Janelle Burke, who's an attorney in the state of Idaho, and next to her is Steve Schenck, who is the Dean of College Relations and Development at North Idaho College, and I shall ask Janelle to commence today's questioning.
Well, let's begin right away by helping our viewers understand what holistic medicine is. Can you define for us in somewhat simple terms, I know it's going to be difficult, but as simply as possible, a definition of holistic medicine?
Surely, Janelle. Holistic medicine is a new term. I think the practice or the concept is as old as medicine itself. When we use the term holistic, actually could be spelled WHO, holistic. It refers to treating the person as a whole person, physical, mental, emotional, and spiritual aspects.
And so you're going to go, as you treat a person, you're going to look at the entire family situation, the entire relationship that they have with their surroundings. Is that correct?
Yes, as fully as we can, definitely.
And you, in your practice, when a patient comes in to see you in the holistic manner, what do you do?
Well,
how does this go?
That's a good question. Basically, I'm a family practitioner. The holistic field lends itself very well to family practice. A lot of our traditional family practice training is centered towards family wellness and family medicine. Even specialists can be holistically oriented. One of the most famous in the country is Dr. Bernie Siegel, who is, of course, a surgeon, and I think he really epitomizes many of the belief systems and approaches towards looking at his patients in a whole perspective. So it's not relegated to internal medicine or family practice or excluding our surgical colleagues. It's really a belief system or a mindset, really.
Now, Susan, how do you fit into this whole picture? What do you do?
Well, two of the things that I believe are really important in a holistic viewpoint of health would be nutrition. What are you eating? How are you eating? What are your food sources derived from? We like to see people who have a wide variety of food sources, and hopefully from the most natural form possible, whole foods. I know it's not always possible to cook things from scratch these days when we're racing around and bustling around in our busy lives, but to like Will was talking about earlier, what did our grandmother teach us about eating? To take foods in their most pure form and eat a wide variety of things. So I do some nutritional counseling, and the other thing that I think is really important is looking at health from a mindset, from a emotional standpoint. How are my thoughts and my feelings contributing to my health, wellness, or lack thereof?
In our brief conversation before this show, one of the things that you said was that positive thoughts could have good effects on our health.
That's true.
Can you flesh that out a little bit more? Talk about that a little bit more.
Yes. What we found in the study of psychoneuroimmunology, which is a field of medicine that involves thoughts, feelings, and how they relate to the immune system, what we do know is that if we are positive thinkers, if we come from a positive mindset, our immune system responds to that and functions more effectively. On the other hand, if we are thinking negative thoughts or being in a depressed state of mind, sometimes that can have an adverse effect on the immune system. So this isn't to say that we are to blame for the health of our body. I want to make that distinction, because I think sometimes we hear these things that, oh, I must be responsible for my illness and I must have created it in some way. No, let's just use the tools that we know that we have to enhance nature, to enhance our body's ability to heal itself. And we have that ability.
Steve Sheen.
Will, is holistic medicine something that's new and emerging on the medical scene, or is it what country doctors used to practice and maybe something that's coming back into vogue?
That's a great question, Stephen. I would say the latter. I think some of the forces that we physicians face now, specialization and increasing bureaucracy and all of that stuff, tends to push us into a more narrow way of interacting with our patients, whereas our predecessors, the country doctor, really was one of the original holistic practitioners. They would do house calls and see how grandma was faring and get to have a view of the whole family, and often see their farm and what they were eating, and basically get a whole idea as to lifestyle. And that's a lot of what holism is how do people live, and we know that affects our health and our well-being.
Susan, the patients excuse me, that typically come to see you and Will are, and this is a little unfair because I know they're not all going to be alike, but by and large, are they people who are struggling with health problems that they haven't been able to solve in some more conventional means? Are they people who just need a family physician and really don't know the difference between holistic medicine and other forms of medical practice? How would you describe them?
That's a good question. I think that Will has described a lot of our patient population as being the walking wounded. These are people who typically have gone from practitioner to practitioner looking for answers to their more complex issues of health. Some of our people have quite complex symptomologies, and it's not as simple as just looking at one aspect. It oftentimes involves a lot of different organ systems, and chronic fatigue syndrome would be something that we see, multiple food allergies, chronic autoimmune problems we look at. So I think these are the canaries, so to speak, of today's lifestyle. And you remember the story about the canaries in the mines. When there was not enough oxygen, the canaries croaked and everyone fled the mines. Well, we have quite a polluted environment now that we're all kind of up against. So we see a lot of people with chemical sensitivities and environmental illness as well.
Will, I think it's probably important to let people know that you are equipped to treat illness beyond counseling people about diet and exercise and other wellness issues. Isn't that correct?
Yes, a lot of the work that we do is preventative, and that's where I think lifestyle counseling and nutrition really plays a role. When it comes to dealing with illness, that means really we're kind of coming from behind the ball, so to speak. But when we are dealing with this sick patient, I think we have a whole variety of tools to pull into play here. And depending upon the illness and the patient, there may be a variety of options to choose from. It may include the traditional standbys, medication, pharmaceuticals, surgery, chemotherapy, radiation therapy, all of these wonderful tools that I think we would be at a great loss to not have available. What we add to that are a variety of some new and some old tools that I wasn't trained in medical school. They're tools that I've learned along the way since I graduated, and I think very nicely round out the offerings that we can use for helping people recover health and hopefully stay healthy.
Will, I'm glad you answered that question for Steve, because I was thinking along those lines. We've made so much progress in the medical field with what you're talking about in medications and surgery and chemotherapy and CAT scans and so forth. But as we've done that, as we have in other fields, as we get fascinated with the new technology, is that one of the reasons that we threw away some of the other practices because we became so fascinated with that system? I'm trying to get at why some of the treatments we used to use with herbs and so forth have gone by the wayside. Certainly you being holistic in your approach, but why has the medical field done that, or the medical schools?
Well, that's an excellent question, Tony, and I'm not sure there's an easy answer to that. And perhaps in summary, it might be said that progress does take its toll. It seems the incredible advantages of our technology we can't belittle, but one of the disadvantages is it seems to have removed us further and further from sitting down and talking with our patients. I see it in myself. I started medical school in 1970, and in those 25 years now, my thoughts have moved away from, to a certain extent, what I can learn by talking with, listening to, examining the patient, moving on to a more technologically oriented standpoint. When I was in medical school, we didn't have CAT scans, and so we had to learn how to very subtly evaluate the neurologic presentation of a particular patient problem. Now, it's a no-brainer. You've got a neurologic problem, you order a CAT scan. It's an automatic knee reflex almost. So.
But I hear you saying something very, very important, and there's an analogy here. If you have a complex business as an individual or company, you go into a CPA, and they must take you through, or you take them through your whole business so they know how to structure your accounting system and your taxes. And I hear you saying that one of the things that's been partially lost in the medical field is that we don't find out about the totality of the individual before we deal with either preventive recommendations or medical treatments that are intervention because of illness.
I think that's very well stated and very accurate.
One of the questions in that area, we also read a lot in the national media about that sometimes there's too many drugs that are prescribed. Could you explain to our viewers how that you can, one, become allergic to overuse of certain medications, or that there can be certain chemical reactions?
Yes. Pharmaceuticals, unfortunately, are not a totally even gift to mankind. Like most things, there's a double-edged sword here. My sense is that the value of pharmaceuticals is for treating more and more serious and severe derangements in the body. We were talking earlier, when I look at prescribing a drug, thinking about surgery, even recommending a vitamin or mineral supplement, it's very simple to analyze the relative benefits that a patient may get versus the side effects or the disadvantages or the potential adverse effects. So it's just a simple balance. With something natural, like an herb, homeopathy, vitamins and minerals, there is definite benefit. It's been proven over and over again, and the risks in general are quite low, very acceptable risks. In some cases, I would say almost non-existent. As we move up the scale in terms of aggression and strength, the benefits may go up, but unfortunately so may the side effects. The chance for allergy, the chance for adverse interaction with multiple pharmaceuticals increases dramatically, exponentially, as we add more and more drugs to a person's profile. And so at some point, even with the greater benefit, the disadvantages start to become pretty much of a trade-off. And I think each one of us as individuals have the right to decide for ourselves where we draw the line in terms of our own choices in the matter.
Susan, you already talked about nutrition, but another issue is exercise. I'm going to do a little role-playing with you for a moment, if I may.
Okay.
I come in and I've consulted with both you and Dr. Correll, and I'm looking for a plan. Take me through a checklist of not only what kind of foods I should eat and the exercise, and then if certain things happen, should I have a yearly checkup and so forth? Just give me kind of a checklist. I know our viewers would love to have that.
Kind of an overview, huh?
Yeah.
I'd probably ask you a lot of questions to start off with what kind of lifestyle do you have? I mean, I know you're a college professor. You probably sit at a desk and do a fair amount of research and studying. So I would ask you, do you get out? Do you move? Do you walk? Do you run? Are there things that you enjoy doing? I find that a lot of our clients don't want to be told to go from step A to step Z. They want to know, what can I do to start improving my health gradually? Because it's not realistic to take someone who's on the fast track and say, okay, now I want you to go out and start running 10 miles a week, if they're not ready to do that. So I would take you through, a graduated program of exercise. I would talk to you about decreasing your fats in your diet. I would talk to you about...
So you would need to know what I was eating first
right,
of all.
Right. So I would probably probe you a little bit in that area and find out, what are your strengths and weaknesses, so to speak, in your nutritional program. I would stress, a high grain, high carbohydrate, lots of vegetables and fruits, whole foods, proteins in their good form, maybe fish and chicken and those types of options rather than red meats and
proteins and beans too, isn't it?
And beans and legumes, right? And find out what variety you had and start adding to your variety.
And what would you do for those people who are hooked on sweets?
Well, we have a lot of them, and it's not an uncommon thing to crave. So we would talk about your blood sugar level, and I'd probably have you consult back with Dr. Correll on, is there a tendency for hypoglycemia here, or is it just a conditioned response? Is it something that you grew up with and you're used to having that dessert every night? I might give you some options, some fruit desserts or some things that would take you off the refined sugar and maybe more into some healthier options.
And how about genetics, the history of the family? Would that be important to Dr. Correll?
We take a really complete family history. We probably have some of the most extensive paperwork of most doctors in terms of just finding out, what your history is, what your tendencies are, we do ask you a lot about your lifestyle in those questionnaires. So we have quite a bit of data on you when you come in as a patient.
And to finish this list, too, we've already talked a little bit about it, but tension is, I hear you saying, is harmful to the health. And so would you recommend ways that people could reduce tension when you knew their lifestyles?
I really try to stress taking some time out for yourself every day. And I know that life's busy for most of us, but even 30 minutes of doing something that gives you joy, or doing some deep relaxation in terms of deep breathing, stretching, whatever it is that kind of makes your heart sing. I tell people, put it right in there on your calendar book, because otherwise it's not going to happen.
It is. Takes some organization and some discipline.
And some planning. Like, we cook food that we can eat for lunches all week long, so we don't end up going out to lunch every day and eating food that maybe isn't as healthy as we would like. So we take our lunch to work and do things that are kind of improving the way that we used to, run out to lunch.
I'll return to Janelle Burke, but I will just testify that I had lunch with you today, and you were very wise in your choice.
And so are you, Tony.
That was just for your benefit.
Right, he ordered a salad, and I thought, boy, he's on the right track here.
Well, I want to follow up a little bit on the stress question, the tension, but stress in our lives. I think that's a very common thing in today's fast-paced world. Suppose, and it's a dear subject to my heart as well, suppose that I present at your office and I'm saying, I just can't deal with these things anymore. I've got all of these things and I've got symptoms, I've got headaches or I've got stomach aches or whatever. Then what do you do? What is the process?
Well, when we're talking at first, I would try to do some problem solving. The two ways that I see of looking at stress is first, do a stress inventory. What are the things that are causing you stress? And what's the priority, and what is your attachment to that particular activity? I mean, if it's a job, that also has the side benefit of providing food on the table and that sort of thing, so I'm not saying we should leave our job. But are there certain aspects to the job that could be changed? So if we can identify the stressors and they are capable of change, do so. That certainly makes a lot of sense to just start with that. Probably on the list there will be several things that we can't change. This actually kind of lends itself well to the Serenity Prayer, doesn't it?
Yes.
Change the things we can change. This is going to be one of those, accept the things that we can't change. There are going to be some things that just bug us, but we can't quit our jobs, for example, at least not right now. So develop some ways that those things can bug us less, some ways of de-stressing that element and taking out some of the nasty barbs to it. It may be deep breathing whenever the boss comes in. It may be going out for a walk at lunchtime and letting off some of the steam. It may be listening to music to and from the work. Maybe a variety of things that are individual for each of us. Oftentimes this may involve some particular technique or practice. Again, the breath is very useful. There are a variety of my colleagues, specialists, counselors and psychologists and so forth, who deal specifically with modifying stress. The work that Susan does in terms of some of the psycho-emotional aspects and just relearning how we react can often help to take the top off the pressure cooker, so to speak.
Now, you would say also there are probably some foods that you could eat that would help you. Is that correct? Or is it not
Probably
so
more
much?
foods to not eat. I
Yeah,
I
okay.
hate to put it from that angle, but the coffee is one that's definitely going to create more adrenaline and is going to make us feel more edgy. And if we tend to be stressful individuals, the caffeine and the sugar are two of the things that I would probably say, let's wean you off those and maybe add some herbal teas. And there definitely are some teas and things that are more calmative, like chamomile tea is a very nice calmative tea to take during the day. So there are things that we can take out and things that we can add to sort of balance out the system. And I really think that's what the body's after. It's after balance.
What about substance abuse? Same kinds of things? When a person presents at your office with substance abuse, it's a matter of changing the whole relationships?
Exactly. It's changing the relationship that we have with that particular substance. There are tools available that may help. Certain nutrients have been researched very nicely with alcohol, for example. Certain amino acids, certain B vitamins and vitamin C tend to help the body deal physiologically with cravings. Obviously, a lot of psycho-emotional work looking at that. For smoking, I am an ex-smoker. I'm a recovering smoker addict, and I was able to get rid of the habit with the help of some acupuncture. And so for about 12 years now, we've been using acupuncture to assist people in stopping smoking. Acupuncture is used for all types of drug addiction at this point. So there are some tools available.
Before we go to Steve, I want to give your telephone number. You have a voicemail, I know, Susan, where people may have more questions than what we've dealt with, particularly that checklist I was going over. And this time we're going to ask our staff to put up on the screen your phone number, and I will give it also. It's area code 509-624-4937. It's come up on the screen now. Again, 509-624-4937. For more questions about the holistic approach to life, Steve Shink.
We've talked quite a bit about good foods and bad foods and a balanced diet. Tell me a little bit about how food supplements and food allergies enter into your practices.
Is that one mine?
That one's yours.
Okay. First, food allergy. This relates to the center of attention for naturopathic physicians for years has been the intestinal tract. Interestingly, even in the medical realm, if you look through old textbooks, the 20s, 30s, 40s, there are statements all the time that come through, health begins in the intestine. And the GI tract is where our relationship with the external environment becomes internal in the gut. So there's a lot to be said about food allergy. What we're finding is that it's very common for people to have previously undetected or even unsuspected reactions to foods.
Now we're talking about more than an upset stomach or diarrhea. There are many other things that manifest themselves from food allergies.
There are many reactions. Actually, the British have led some of this research, and here in this country, it's still we're still sort of dragging our feet. I know that a lot of my very excellent allergist colleagues don't really accept food allergy as broadly as I found it to be very useful. But we find very diffuse symptoms such as fatigue, generalized congestion, the dark circles under the eyes that you see commonly are nicknamed allergic shiners because it's so commonly present in food reactivity. Little kids who have recurrent ear infection, oftentimes eliminating or decreasing the amount of dairy and or wheat will significantly decrease the mucus and the congestion that leads to ear infection. And then a whole variety of gastrointestinal problems, the irritable bowel syndrome, diarrhea, constipation, cramping, bloating, gas, a whole variety of symptoms that seem to be reactive to foods.
And I know we don't have much time left, but your views on food supplements, are they necessary?
As we talked before, I don't think our bodies were designed by the good Lord and Maker to need a handful of vitamins. That's my belief that I started out with. I also am not sure that he clearly had in mind the environment that we'd be living in. And I think we do have a need for supplementing our environment, our food with supplement based on the pollution, the poor quality of food, unfortunately, that we are able to get, the amount of stress that we're under. All of these factors increase our needs for nutrients greater than what we can get in our foods.
We have less than a minute, but I believe I hear you saying also when you're purchasing food, you should really see what's in them and watch that carefully.
Be a label reader.
Yes, and that way you'll avoid certain chemicals and so forth, and more natural foods.
A real quick rule is the smaller the label of ingredients, the safer it is. When you see a big, long line of lists, you don't even have to read it. You know that it's got a bunch of junk that you don't need.
What an informative note on which to end. Thank both of you so much, William Correll and Susan Philly, for being with us. You've been extremely informative, and we're grateful to you. And ladies and gentlemen, I would invite you to be with us again next week at the same time, and we'll discuss yet another issue that we think will be of significance to you. Until then, please have a good week. I am Tony Stewart.
The North Idaho College Public Forum was videotaped live from the studios of Instructional Technology on the campus of North Idaho College for viewing at this more appropriate time. We invite you to join us again next week for another all-new edition of the North Idaho College Public Forum on this public television station.